Welcome back, everybody. Okay, so I've been trying to think about how to best title these kind of videos. I'm just going to say, let's call them reminder videos. They're to remind us what came before Queevid 17. Okay, you get what I'm saying. So let's get into it anyway. Just bring that back and go.
Pneumonia is an infection that causes inflammation in the lungs and results in
There's our little friends.
fluid buildup, fever, cough, and difficulty breathing. It's caused by a variety of organisms, and that is exactly what we are going to discuss in this video. So if you're ready, let's get into it.
Okay, I'm into it.
Before we go any further, just know that we are not doctors. This video is for informational and entertainment
That guy is not a doctor.
purposes only. First and foremost, what are the causes of pneumonia? Pneumonia has several different causes, including viruses, bacteria, fungi, and even parasites in some cases. Common viruses that can cause pneumonia include the flu, RSV, and the common cold. Common bacteria that can cause pneumonia include Streptococcus, Mycoplasma, Haemophilus, and Legionella. And last but not least, common fungi that can cause pneumonia are Pneumocystis, Cryptococcus, and Histoplasmosis.
Isn't that an incredible amount of things that can cause pneumonia? All of those things, right, that can cause pneumonia, cause your lungs to give the result of pneumonia. Let's continue.
What are the signs and symptoms of pneumonia? The signs and symptoms of pneumonia can vary in severity from person to person. Here are some of the most common examples: productive cough, fever and chills, tachypnea, shortness of breath, chest pain, diaphoresis, fatigue, and cyanosis. Keep in mind that there are other signs and symptoms of pneumonia. These are just some of the most common examples.
So it seems like there are a number of different factors that can cause the end result of your lungs being a certain way. Let us
What
continue.
are the types of pneumonia? Pneumonia is often classified according to how the patient acquired the disease. Here are the different types. You have community-acquired pneumonia, hospital
Best one to get is the community-acquired one, because it's always good to have community.
acquired pneumonia, ventilator-associated pneumonia, and aspiration pneumonia.
I never aspire to get pneumonia.
Community-acquired pneumonia is when a patient gets it outside of the hospital. Hospital-acquired pneumonia, as the name suggests, is when a patient gets it during their hospital stay.
Okay, so community-acquired pneumonia is when you get it outside of the hospital. Hospital-acquired pneumonia is when you get it inside the hospital. Okay? Do you see the order of it here? So, I don't know whether this particular group worded it in this way, but to say community acquired is when you don't get it in the hospital. So the hospital is the object of deference. You're deferring to the hospital by saying it wasn't acquired in the hospital. Could be rhetoric, may not be. Let us continue.
And ventilator-associated pneumonia is when it's acquired while the patient is on the mechanical ventilator. And lastly, aspiration.
How do you get pneumonia when you're on a ventilator? When you have something covering your face, covering the very air holes that you breathe through, your nose and your mouth. And you may acquire pneumonia while a hospital device, a device used by the hospital, by medical staff, gives you pneumonia. Good Lord.
Pneumonia is acquired when a patient aspirates bacteria into the lungs, usually from food, saliva, or stomach acid. Now let's talk about the diagnosis. How is pneumonia diagnosed? Pneumonia is most commonly diagnosed by looking at the patient's chest x-ray, which will show signs of consolidation. Some other tests and findings to look for include their vital signs, ABG results, PFT results. You can look at the sputum culture, complete blood count, CT scan, and pleural fluid culture. The patient's pulse oximetry would likely reveal hypoxemia, and a faster breathing rate is common as well. The patient's breath sounds via auscultation will likely reveal crackles or rhonchi, and if you perform a chest percussion, a dull sounding note would likely be heard.
Not necessarily do you have to be pitch perfect.
The patient's PFT results would likely reveal decreased lung volumes and capacities. A sputum culture would reveal which type of bacteria is causing the infection. It could either be a gram-positive or a gram-negative bacteria. And a complete blood count would provide the patient's white blood cell count in order to help determine if the infection is viral or bacterial in nature. For instance, increased white blood cells indicate that a bacterial infection is present, whereas decreased white blood cells indicate that a virus is causing the infection. So moving right along, what is the treatment for pneumonia?
Interesting.
Pneumonia should be treated on a case-by-case basis, but in general, here are the common treatment methods: antibiotic medications, oxygen therapy, bed rest, airway clearance therapy, hyperinflation therapy, and fluid management. Again,
It's always good to manage your fluid.
each patient will be treated differently depending on the cause and severity of the symptoms. In severe cases, intubation and mechanical ventilation would be indicated. Now,
Don't think I trust the mechanical ventilation part after finding out that you can get pneumonia from ventilation.
let's talk about the risk factors for pneumonia. It's true that patients of all ages can get pneumonia. With that said, some are more at risk than others. Here are the risk factors of those who are most at risk. You have infants who are less than 2 years of age, adults who are greater than 65 years of age, those with weakened immune systems,
Underlying causes.
those with chronic conditions such as asthma, COPD, and CHF, those with recent.
Can you imagine getting pneumonia when you already have chronic obstructive pulmonary disorder or asthma? Good Lord. And we haven't even mentioned COVID-19.
Respiratory infections such as the flu or common cold, those who have been intubated and receiving mechanical ventilatory support, those who recently had a stroke, those who smoke tobacco, and those who are exposed to pollution or lung irritants. Keep in mind that there are several other risk factors for pneumonia. These are just the most common examples that you should be familiar with. So now let's talk about some of the ways to prevent pneumonia.
Don't smoke. Don't go on a ventilator in a hospital.
The CDC recommends certain vaccines for the prevention of pneumonia, including the flu vaccine. Another way to prevent pneumonia is to.
Let me see if I get that right.
The CDC recommends certain vaccines for the prevention of pneumonia, including the flu vaccine.
So the flu vaccine is recommended by the American CDC as a way for preventing pneumonia. How? Through correlation?
Vaccine. Another way to prevent pneumonia is to quit smoking if you're a smoker. Also try to avoid breathing in polluted air. You should regularly wash your hands and keep them away from your eyes and face. Be sure to cover your mouth and nose as you cough or sneeze. And you can strive to maintain a healthy diet and lifestyle in order to boost your immune system and overall health. Now I just want to share a little TMC exam hint about pneumonia for all my respiratory therapy students out there. This is just something to look out for when you take the board exams. Now, I mentioned it earlier, but you should definitely be familiar with the word consolidation. Pulmonary consolidation occurs on a chest radiograph when the lungs are filled with fluid instead of air. And as it turns out, Pneumonia is the most common cause of consolidation. So whenever you have a question that even mentions consolidation, your first thought should be that the patient likely has pneumonia. Now, of course, you need to look at the signs and symptoms in order to verify this, but just as a general rule, whenever you see consolidation, you should think pneumonia.
I'm going to guess by consolidation. I'm no medical expert, but I'm going to say that through consolidation is, I could be wrong about this, is when the lungs have fluid. And when you tap them or bang them, you get a particular sound, which is not the same as when you tap them and they're full of air. So that could be what consolidation means. May not be.
Real quick, guys, do me a huge favor and hit the like button. I hope you like the info. Or just a casual viewer, hopefully you now have a better understanding of this disease. We're going to go even deeper into this topic in future videos, so again, definitely subscribe.
Okay, so you saw a lot there, which gives you kind of like a low-level introduction, an introduction to pneumonia, which is a respiratory disease to do with the lungs. Okay, that's solely pneumonia. My mother got pneumonia twice in her life, and she got pleurisy twice in her life, but she was a very heavy smoker. Okay, she smoked incredibly heavy. She smoked a pack of cigarettes every day. Okay, she weakened her lungs, and basically, eventually she ended up getting COPD, which is chronic obstructive pulmonary disorder, which is basically just the damaging of the lungs, the things which you have for breathing with. Okay, so was there anything else I wanted to talk about with that? Yeah, basically, up until this year and the last year, I used to get a really racking cough. Not all my life now. It was only, I'd say in the last 5 years, 5, 6, 7 years, I'd get it around October, November, and it would just rack and rack and rack. And sometimes I'd have to go to the doctor and get a little thing for breathing to give my lungs some kind of expansion and some kind of ability to open up and breathe. Thankfully, I didn't have it this year because I probably would have had the ambulance services sent around to my door. I'm thankful that I didn't. Okay, so no cough this year. My lungs must have recovered, or there must be some kind of equilibrium occurring in my lungs to do with whatever that has disallowed for that cough to take place. So that's it, really. What are we at? We're at 13 minutes here. That's all I wanted to talk about. So from me, signing off, take care, and I hope the video was of some interest to you. Bye.